Hi, I'm Dr. Matt Wingate from Orthopedic Institute in Sioux Falls, South Dakota. And today I wanted to talk about the top 5 signs of scoliosis in children and when to schedule an appointment with a spine specialist regarding scoliosis. So to get it started, number 1 of the most common things that we'll see with scoliosis in children is asymmetry of their shoulders. So they'll notice when they look in a mirror or when they're getting dressed that maybe one shoulder is higher than the other. This can be due to a curve of the spine and rotation of the spine that can create increase in musculature or prominent musculature in one shoulder or one trapezius muscle than the other, and this can be a sign of scoliosis. Number 2 is chest, or in girls, breast asymmetry. So if there's a curvature of the spine, especially the thoracic spine, which is our middle back, if there's a curvature of that, not only with an S-shaped curve, but also a rotation of the spine, that can cause our ribs or our chest or our breast to protrude or to appear more prominent on one side than the other. Number 3 is waist asymmetry. So if the scoliosis is involving more of the lumbar spine, which is our low back, again, it can cause a S curve or an S shape in our low back, but also cause a rotation of the spine in the low back. And this then can lead to an asymmetry in our waist or what we call our flank creases around our waist. Number 4, and this may be the most common one that we'll see, so these aren't necessarily in order, but a razorback or a rib hump deformity. So with scoliosis, mostly affecting the thoracic spine, which again is our mid-back, where our ribs come off of our spine, if there's a significant rotation to the spine that causes the ribs to also rotate, and especially when a kid bends over, reaching towards their toes, we can see that one rib cage is higher than the other. This has been referred to in the past as a razorback or a rib hump. And it's actually one of the most simple tests that primary care physicians, therapists, or even scoliosis surgeons can do looking for scoliosis. Number 5 would be suspected scoliosis with a family history. So if there are multiple children in a family with scoliosis and there's some concern from mom or dad or another family member about scoliosis, that would also be a reason to say, hey, let's go in, let's get an x-ray, and let's see if in fact this child does have scoliosis. So those are the top, some of the most common reasons that we'll have patients see us in the clinic for scoliosis, and mostly related to a physical appearance: the shoulder, the chest, the waist asymmetry, the razorback deformity, and then family just having concern due to maybe a family history of scoliosis in other kids. If you have questions or want further details, please don't hesitate to reach out to us at Orthopedic Institute. Again, my name is Dr. Wingate, and we can be reached at 605-331-5890. Thanks for your time.